Hello, my name is Chichioku, and I'm the Executive Director for EverThrive, Illinois. Thank you so much for joining us tonight for the virtual portion of our annual event. I first want to start by thanking our co-chairs, Barbara Staples King and Robin Gable, and the rest of our host committee for their amazing and tireless work to ensure that tonight's event is a success. I also want to congratulate our 2022 Changemaker awardee, Brenda Blasingame. Brenda has been an amazing leader in the child health equity and family health equity space for many, many years, and we join her in this tireless fight to ensure that all families here in Illinois have access to the healthcare and resources that they need to thrive. Here at EverThrive, we do that by ensuring that all families have access to the contraception of their choice so that they can make the right decision about when, if and when to start a family. We're also working tirelessly to ensure that all families have access to high quality, comprehensive healthcare. And that means before, during, and after pregnancy. We're also working to build healthy communities by ensuring that they have access to life-saving vaccinations against diseases like COVID-19. Now more than ever, we need your support. The pandemic has only exacerbated the disparities that existed before, and we need more champions for health equity to ensure that all families have the resources and the healthcare that they need to thrive. And we hope that you will join us tonight by making a donation to support this crucial work. Thank you so much for tuning in, and we hope to see you in person next year.
My name is Dr. Mia E. Lane. I am a board-certified obstetrician gynecologist. African American women are afraid of being pregnant. They will actually say that they're afraid of delivering a baby. They are afraid of potentially dying during their pregnancy because they see the numbers. And that fear is legitimate, and it should be recognized, addressed, and handled with care.
My name is Kirby Range. I'm the Birth Equity Manager here at EverThrive, Illinois. Maternal morbidity is known as having more adverse, poor health outcomes that can result from the birthing process and from going through the pregnancy. Maternal mortality, on the other hand, is a maternal death that can happen anytime from the mother in the birthing experience going through delivery up into a year postpartum. And what we were seeing is that majority of these maternal deaths that we're experiencing in our country, and especially here in Illinois, are preventable.
In the state of Illinois, African American women are 4 times more likely to have bad outcomes from their pregnancies and their deliveries compared to white women that have the same socioeconomic status, the same education level.
And that's unacceptable in our country. And we know that there's a lot of work that needs to be done. And so our work here at EverThrive with our birth equity priorities is to really tackle these staggering rates that we're seeing for maternal deaths.
My name is Mary Gray. I work for EverThrive, Illinois, and I'm an outreach worker. Maternal mortality and maternal morbidity was one of our, I think, best campaigns that we had because it dealt with women of color. And I say it was more challenging because when you say maternal mortality, maternal morbidity, a lot of people didn't understand because those are the medical terms. But when you explain to them, what's going on, then they say, oh, that's what I had, or that's what's going on with me.
My name is Taliba Johnson, a community engagement coordinator here at EverThrive, Illinois. We're going to schools, we're going to these clinics, we're going to these health fairs and job fairs, and we're actually meeting people where they are. We're gathering this information that we collected in these surveys. We're taking these emerging themes, and we're actually being able to transcribe these focus groups that we had as well. And we're taking emerging themes from those, and we're saying, what is the community saying? How can we tailor a campaign to fit what the community needs? And then on that other end, we're taking the research that we have, and we're trying to see how can we turn this into something that we can bring back to changing policy.
EverThrive is very committed to our birth equity priorities, and we're engaged in numerous different projects and initiatives to really address these high maternal mortality morbidity rates that we see. We are partnering with the City of Chicago with the Family Connect Chicago initiative to ensure that all birthing people receive a postpartum visit in their home by a registered nurse, where they are checked to make sure they're healthy, their baby's healthy, and they're connected to resources and services in their communities.
If there's an insurance issue, we're working on things like advancing Medicaid expansion to cover 12 months postpartum.
Doulas are birthing coaches, and they provide a tremendous amount of support for the birthing person, and that's why we're so happy we're able to take a strong lead in this new legislation that we received, so that all people have the access to be able to have a doula and can afford the doula care services.
What makes EverThrive mission so special to me is that we actually care. You know, it's not just about Mary caring, it's about everybody working as a team, trying to get the message out there.
This is not a one-person project, because we know that when we collaborate and we work more intentionally with each other, we're more likely to have better results and to be able to best meet the needs of people in the right way.
EverThrive is special in that it tackles health inequities where there's not many organizations whose sole focus is to address these issues in our healthcare system.
If you have whole organizations that are willing to stand behind this one organization's messaging, you gotta know that they're getting it right, you know? You gotta know that they're amplifying the right key points in certain topics and certain subjects that other people like. I want to repeat what they're saying. I want to, mimic or replicate what they're doing. They're not just doing it here in Chicago. You know, they're champions through the whole state of Illinois.